Hi, my name is Wasif, and welcome to the Pumpkin Patch, where we talk about adventures in parenting as well as health and wellness. It's presented by iCare Pharmacy, where I'm a pharmacist and an owner. So if you have any questions about the podcast or need help with a prescription, you can feel free to text me at 780-705-8871. We provide free delivery as well as expert advice all throughout Edmonton, Sherwood Park, St. Albert, Beaumont, as well as even Stony Plain. So if you do like the podcast, please give us a 5-star rating and hit subscribe. Thanks so much for dropping by, and I hope you enjoy our little conversation here. Thanks. Bye. My name is Wasif. I'm the owner and pharmacist of iCare Pharmacy, Windermere, and welcome to the iCare podcast. And so if you have any questions in regards to this podcast or any questions about your health in general, feel free you can always text me at 780-705-8871. And yeah, I'll definitely reply to any questions that you may have. So today off camera, I have my wife, Dodo. Say hi.
Hi, everyone.
And I also have a very good friend of ours, Simone Rambaransingh. So here she is a speech therapist, speech pathologist. She's been graduated from the University of Alberta in 2003, and she, helps a lot with kids in regards to helping them with their speech, and also as well has a special interest in kids on the autistic spectrum as well. So yeah, thank you so much for joining us, Simone.
And hi, nice to be here.
Yeah, so Simone works at Body Restoration. So she's just my neighbor upstairs. So whenever it's too loud, I just hit the broom, tone it down up there. That doesn't happen. But So just in the Windermere area, and so I thought it'd be great to have Simone on because this video is probably not gonna. This podcast is probably not gonna be online until after we give birth, sort of thing. But I thought it'd be still a good idea to kind of get her on and just kind of help build us expectations and what we can do in terms of, what do new parents and what can they do to kind of help maximize and be able to what's the word? Trying to help the baby with speech and that sort of thing down the road.
Exactly, right? Because our kid is probably going to be speaking 3 different languages. I'll speak mostly to the kid in Arabic and English, and then Wasif will, or do we want him to be multilingual. Yeah. So how do you do that without confusing brains out of the kid?
Well, first, I guess, what is the age that kids normally do talk?
Do develop language abilities?
Yeah. So babies, as you know, babble. They start by babbling and cooing and making different vowel sounds, ahs and ohs and that kind of stuff. And then they start babbling, and there's different types of babbling. It gets more sophisticated. Usually babies are 1 before they start to say words. Some are a little bit earlier than that, but the expectation is for them to say 1 word by the age of 1. Usually that word is mama or dada, right?
Yeah.
And then then they have a huge language and word vocabulary boost of language that happens. So between 1 and 18 months, they go from having 1 word to 50 words. So that's where you see a lot of those words coming in. And then by the age of 2, kids usually can put together 2-word phrases. So go up, no banana, more please, that kind of little telegraphic type of speech. So it is interesting to note, though, that when you're learning more than 1 language, some kids will seem delayed, right? And the reason that they're going to seem delayed is because their brain is acquiring more than 1 grammar. So it's not really the vocabulary. The child will still have lots of vocabulary, but their grammar might seem difficult because they're acquiring more than 1 grammar. So their brain is trying to decipher which rules apply to this one, which rules apply to this one. So we know that's different for kids. So you might find that the kids aren't using verb tense appropriately, for example, until a little bit of a later age, but it's not to worry, they're not behind. They will catch up. It's just that they're learning more than a kid who's just learning one language.
Yeah, just as a side note, it's interesting that when I was young, I went to a speech therapist, and I was so upset that I went to a speech therapist because I was like, my parents think I'm stupid, right? My parents don't think I'm smart, but obviously, as a kid, right? That's as an adult, you obviously understand where that's coming from. But do you ever run into kids who just say like, "Who is this lady? Why am I here?"
Yep, I had, and some of the kids I see are extremely smart. That's actually part of the problem. So what they do is they're really fast talkers, or they have so much to say that sometimes their grammar seems to fall a little bit behind, or they're just going so fast that they might have a bit of a stutter where they're repeating sounds, or if they have a lisp. So a lisp is when your tongue pokes out for the S and Z sounds. That's kind of the typical one, that it's hard for them to correct it because they go so fast. They speak so quickly that to slow down and focus on fixing a sound is tricky. So that's interesting that you went, Wasif. Do you remember what you went for?
No, I don't remember. I think it was something. I think I had delayed speech,
Yeah.
but we were a household that was learning two languages, so
Yep.
maybe that's the reason why. I don't remember much of it except like I was playing a lot with toys, so it seemed like okay at the time. So it
You
was.
said
Yeah,
that
and I like how you say that, because pretend play is a great indicator for a child's language skills. So when kids are able to pretend play, get into characters and play really appropriately, we worry less than kids who don't get the whole play thing.
Yeah. That's
And you know what? Lots of research came out, and the reason the research came out about this dual language learners, or in your guys' case, maybe even 3 languages, is because we've had so much influx of different languages and cultures in the schools. And what we get now sometimes is 2 parents who are here in Canada. They speak a different language, and their English grammar is not great. It might be good, but it's not great. Or in some cases, it's really not very great. But then they want to teach their child English, right? So they make that a priority. So they're speaking primarily to their child in their broken English. So we actually discourage that. We discourage that because we want the child to acquire your best grammar. So if your first language is, Chinese, Tagalog, French, and your English is broken, then we would say speak in your primary language, because we want your child to acquire a very rich grammar and an appropriate grammar.
Oh, that's really interesting.
Yeah, and then when your child goes to school, they're going to pick up the English. So we don't have to worry about that. They're going to get the English, and as long as they have a strong foundation, they're going to do really well. So that's one of the things that we do encourage parents, is to speak to their children in their best language.
Yeah, the one part I like about your practice is how big of a play area you have.
Yeah.
But I see sometimes that when you have kids come to join you, sometimes, like, I don't think so much during COVID, but pre-COVID, you would meet them downstairs and kind of meet them and the parent, and then escort them up. Is that just to kind of make them feel more comfortable to be able to join you?
Yeah, I think sometimes the parents feel a little bit, or the kids maybe feel like they're coming to the doctor's office, because we are part of a doctor's office, and I just want them to feel like they're coming to play with a friend, so that they're really relaxed when they're coming to speech. And I don't think that children should have work. The children's work is playing. So all of speech therapy that I do takes place during play. Like, a kid should never feel like they're being forced to work really hard. I think it should be fun and encouraging and that kind of thing. So I wouldn't be surprised if you knocked on the ceiling with your broom, because we are very, very noisy.
So the other question I had was, kids, they'll form concepts of things before they actually form the actual language to express it. And I know in some cases parents will use sign language with the kids to kind of help with that transition. Is that something you recommend, or what's your
Yeah,
thought?
I love baby sign language. So that's just the very simplest gestures because usually, so I said kids speak at around 1, right?
Yeah,
That's when their mouth and their muscles are able to do fine motor movements necessary for speech, right? But
yeah,
often their understanding comes before that. So they actually get a bit frustrated, right? So
yeah.
they point and you think they're pointing at the apple, and you give them the apple, and then you get a tantrum or something like that because what they really wanted was the banana, right? But if you don't have words, it's hard for kids to kind of express what they want. So kids can actually start to imitate simple gestures before they can say the words.
Okay,
So
okay.
for that reason, you could start to use some very basic gestures like more. So you're giving a couple of bites of something and the baby wants more. And they might not even do proper sign like this. They might just do this, like a clapping motion,
Okay.
which is fine. And you go, oh, more. And then you give more. So,
Yeah.
and then the baby feels really empowered because they're like, oh, you understood me. So when you're
Yeah, yeah,
adding
yeah.
those gestures like go or come here or shh, and you put your finger to your lips, the baby is getting visual input as well as auditory. So if you think about if I talk and I say a word, so I say banana.
Yeah,
So you heard it, but now it's gone, right?
yeah.
So you can't check, you can't go back and see what I just said. It's already over. So if I hold up my finger and I'm showing you the symbol, you
Oh,
can keep referencing it, right? You can keep
Yeah.
referencing it
yeah.
because I'm still doing it. And so the child has 2 ways, 2 modalities to take in the vocabulary. And so you're just kind of hitting multiple senses.
What do you use for milk?
Milk is like this,
Oh, like this?
like
Oh,
squeezing, like almost like squeezing the cow's
oh, okay,
udder,
okay.
right? It's a
Yeah, yeah,
squeezing movement.
yeah.
Yeah,
Okay, okay. All right,
yeah.
cool, cool.
So how
And
does this
cookie
start?
and
What are you saying, honey?
Oh, sorry, I keep interrupting. I'm sorry.
No, no, I
no,
want
go
you to
ahead.
keep
No,
that.
no, it's just not like I'm thinking like, okay, so yesterday I'm sitting there thinking like, obviously there's going to be, a period of time for us to adjust with the new baby,
Yeah.
the routine. And I'm thinking like, how soon do you start doing these motions with a baby, like a newborn, right? For example, like
yeah,
I'm thinking,
the newborns are teeny tiny, so they can't really see you properly anyways. They say that when the baby is born, their visual distance is from when you hold them in your arm to your face. That's all they can see. If you're even across the table, they can't see you. So you'll notice when baby starts to really respond to you and look at you, probably after 4 months. But you're still talking to baby all the time. I mean, and it's great to be narrating as you go. I wanted to teach my kids French. So what I did was, but my husband doesn't speak French. So what I was doing is all the routine little things I would try to do in French. So I would talk about washing your face, getting ready for bed, singing some songs in French to get them used to the sound of French. But then when we were together as a whole family, it was mostly in English. So, but I think that really helped me to remember to speak in French. So I would do certain things in French and then other times English. So anyways,
So,
it's good for them to get that exposure to the different sounds.
so when you're teaching them like little sign languages before they're able to form the words, that doesn't delay their speech or anything like that, or how do
No, it will encourage their speech sooner. It will
oh,
encourage their speech sooner. And that's a good question because I have parents ask me that all the time, especially with little kiddos who are, are on the autism spectrum. They sometimes worry that if we introduce gestures or any other form of communication, that the child will not use their voice. In
right.
fact, usually it acts as a scaffold for the child to use their words. So
Okay,
it will
okay.
actually help the child acquire that vocabulary sooner.
Helps to kind of reinforce it.
Yeah, totally.
Yeah. And so, what's a difference in terms of learning and language for like a say like an autistic child?
Well, the thing with autism that's so interesting, and of course it's of varying degrees, right? We have perfectly fluently verbal kids with autism, and we have completely nonverbal children with autism who might have other very high intellectual abilities. So I do usually a parent's number one goal is to get their child to speak, because of course that's the easiest thing to understand. But some kids are not going to learn how to speak and use their voice. So part of it, I think, is an ability to formulate your thoughts in your head and then put it out through your voice. Some of these kids do really well with augmentative communication devices. So we use things like touch chat that are symbol based to get clear communication. I have children who can make paragraphs using their touch chat who are unable to speak, or we've taught them to speak on demand, but it's still not their go-to preferred method. So it's really, it can run the full range. No two kids with autism are the same. They all different strengths and different challenges.
Okay. And then how has your practice changed with COVID-19? I imagine, I think you mentioned it to me before, where you had to do a little bit more online and that sort of thing.
Yeah, I did switch over to online. We tried to do things like masks and plexiglass and that type of thing. But the children were finding it difficult. They don't have the full cue from my face if I'm wearing a mask. And then many of my clients wouldn't tolerate wearing a mask because I tend to work with preschoolers. Also, having them wash their hands and try not to touch your face is impossible, with these little kiddos. So a couple of them moved to online classes over Zoom. And then some were not able to have the attention to do that. So some kids have been on hold for some time now.
Okay. And then do you find because we are a little bit more isolated during the pandemic, has it affected any of the speech of the kids? Or it's hard to say.
It's interesting because one kid in particular I'm thinking of has really thrived. I think he's a very high anxiety kid. And so getting ready for school, going to school, not being prepared for what might happen during his day, and then coming home at the end of the day, and he was very, very anxious. So he's been homeschooling since that was offered, and he's really thrived. So his parents are so happy. He went from being a kid who, was just learning his alphabet, and now he's reading. So that's an amazing outcome. The parents are really putting in a lot of effort there. Some kids, I think, have been, the ones that want to be more social, or the ones that need to be working on their play skills and their social skills are struggling, because sometimes peers are the best way for kids to be motivated to talk and to play. And it's hard if you're just surrounded by adults, right?
Yeah.
Yeah.
And then, and honey, you run into a lot, my Dodo, she works at the Edmonton Immigration Services, and she works in a lot of the schools. So she works with a lot of kids who are second language and that sort of thing. Yeah.
It's all online. And I have clients I have students who are Arabic speaking. And so I have to go back and forth a lot between Arabic and English. I have students who are from Pakistan, Somalia, all over the world, right? So I really try to engage them. And the way that I engage them is by saying, okay, well, how do you say it in this language? And we try to find similarities, and that really helps them with their speech, right? Online has been tough. It's worked. One-on-one is great. I love the one-on-one setting, but I think kids are just exhausted from being online. So until we go back in the school, when you're in the school, it's different because you gotta have a lot of social interaction. It's that, that physical interaction that you get with them that really makes a huge difference. But online also afforded me that opportunity to just really focus on really language development and really focusing on, just developing those skills, right? But I think for me, my biggest thing that's helped me, again, like I said, I always try to go back to the kids. I've even dealt with First Nation kids, and I say, okay, well, how do you say it in your first language, right? In the do you speak Cree or Métis? And I'm like, okay, how do you speak? How do you say it like that? And we always try to find similarities. If there is none, we always try to find a bridge in between the both cultures, and that really helps with their learning.
Yeah, that's awesome. I think that's
kind of how I do it.
I think that'd be a great strategy, right?
Yeah.
So.
Yeah, and books, I can't say enough about reading. there's been tons of research and literature to show that if you read to your children, read with your children, and then have a really engaged reading, that they learn language because they're hearing all kinds of different language. Stories will sometimes be told in the past tense, and then they switch to dreams in the future, or they show interactions, you know, those good old fashioned Berenstain Bears books have all of these social scenarios happening, right? Between the Cub siblings and their friends and all these types of things, like, you know, dealing with bullies or whatever, what have you. So it's so great to read and then engage after the reading or during the reading in questions, describing pictures, talking about it. And you could do this, and they bridge the gap between languages too, because even if I was looking at a book that was written in Arabic, I can still, if it's a picture book, I can still make a lot of ideas about what's happening in the story, probably even understand based on the pictures, right?
Right.
And then you can do the pointing and asking questions and doing all of that. So I can't say enough about books, you know.
Okay.
Plus, when you're,
yeah, I think that's great advice.
That's the one thing that I feel like from online that I'm kind of missing. I mean, we try to do a lot of, like, I share my screen, so we use Google Meets or MS Teams, and we share. I share my screen, and I find online books to read. But the biggest thing that I would do when we were not in lockdown is that we would also do pull-out reading sessions with kids, and I found that was amazing. So I definitely agree with Simone on that. That just like the reading, the interactive reading. Like, I read to our baby sometimes. Like, when I'm like doing sessions with the kids, like, I make sure the baby knows, like, hey, we're good. Like, I'm starting this kid early. Like, we're gonna be reading. Because that's how I grew up, right?
So the baby's gonna come out with homework?
Yeah, basically.
Here we go.
Assignment due Friday.
it's awesome. And you can get Wasif to read too, because it's been shown that babies can tell their dad's voices when they're born.
Oh, really?
Yeah.
Oh, crazy.
Oh no.
Okay. I better get reading, man.
Yeah.
Okay, well, yeah, no, that was thanks for joining us today, Simone. That was a lot of lot of homework for us to work on. So yeah, I really appreciate you joining us today.
You guys are gonna do great, and I'm here if you need me.
Yeah, for sure. Thanks a lot, Simone. Thanks.
Okay. Bye, guys. Take care.
Bye. Bye-bye.
Thanks again for listening to the Pumpkin Patch Podcast. Again, if you do like what you heard, thanks again for listening to the Pumpkin Patch Podcast. If you like what you heard, please feel free to give us a 5-star rating and subscribe. And again, if you have any questions about the podcast, or as well questions about your health or wellness, text me at 780-705-8871. And have a great day, and hopefully we'll chat soon. Thanks. Bye.